If you've started experiencing hiccups since beginning Ozempic, you're not alone. Whilst hiccups aren't listed as an official side effect in UK product information, some people do report them during treatment. In this video, we'll explore why they might happen and what you can do about them. But remember, this information is for educational purposes only and doesn't replace advice from your healthcare professional. So why might Ozempic cause hiccups in the first place? Ozempic, or semaglutide, works partly by slowing down how quickly your stomach empties. This is actually one of the ways it helps manage blood sugar levels in type 2 diabetes. But this slower gastric emptying can sometimes lead to your stomach becoming more distended, which may irritate your diaphragm or the nerves around it. That irritation can trigger the hiccup reflex. The vagus nerve also plays a role here. This nerve is involved in both your digestive system and the hiccup reflex itself. When Ozempic affects how your gut moves and functions, it may alter signals along this nerve, which could make some people more prone to hiccups. You might notice hiccups more during dose escalation periods when your body is still adjusting to the medication. So what can you actually do when hiccups strike? Let's talk about some immediate relief methods worth trying. Breath holding for 10 to 20 seconds can help reset your diaphragm. Simply take a deep breath, hold it, and then exhale slowly. Slow, deep diaphragmatic breathing is another option. Breathe in through your nose for a count of 4, hold briefly, then exhale through your mouth for a count of 6. The Valsalva maneuver can also interrupt the hiccup cycle. This is where you bear down gently as if you're trying to exhale against a closed airway. Sipping cold water slowly or adjusting your posture to reduce pressure on your diaphragm may bring relief as well. If you have any heart or lung conditions, it's worth checking with your clinician before trying some of these breathing maneuvers. Prevention is often easier than cure, so let's look at some practical strategies. Eating smaller, more frequent meals rather than large ones can reduce gastric distension. Think about having 5 or 6 smaller portions throughout the day instead of 3 big meals. Avoiding carbonated drinks is important as the gas can increase stomach pressure and make hiccups more likely. High-fat foods slow digestion even further, so limiting these may help. Try to stay upright for a while after eating rather than lying down straight away. Give it at least an hour or 2 if you can. And make sure you're following your prescribed dose escalation schedule, as this allows your body to adjust gradually to the medication. If you're doing all this and hiccups are still persisting beyond 48 hours, it's time to speak with your doctor. They may consider medical treatments depending on your situation. Options might include medications like metoclopramide, though this is only used for very short periods under MHRA guidance. Baclofen is another possibility, or if reflux seems to be contributing, a proton pump inhibitor might be suggested. Your doctor will assess what's appropriate for you based on your individual circumstances. There are times when hiccups need urgent medical attention. If hiccups persist beyond 48 hours or you're worried, contact your GP or NHS 111. Seek help straight away. Call 9999 if your hiccups come with severe abdominal pain, chest pain, vomiting, difficulty breathing, any neurological symptoms, or difficulty swallowing. These could indicate something more serious that needs immediate evaluation. It's also worth knowing that if you experience hiccups or any other side effect you think might be related to Ozempic, you can report it through the MHRA Yellow Card scheme. This helps build a clearer picture of how medications affect people in real-world use. Remember, everyone's experience with medication is different. What works for one person might not work for another, and your healthcare professional is the best person to guide you through managing side effects while staying on track with your diabetes treatment. Never adjust your dose or stop taking Ozempic without speaking to your doctor first. To recap, hiccups during Ozempic treatment may be linked to how the medication slows stomach emptying and affects digestive nerves. Immediate relief techniques like breath holding and sipping cold water can help, whilst eating smaller meals and avoiding carbonated drinks may prevent them. If hiccups persist beyond 48 hours or come with worrying symptoms, contact your GP, NHS 111, or in an emergency, call 999. Have you experienced hiccups whilst taking Ozempic? What techniques have helped you? Share your experience in the comments below. And if you found this helpful, please give it a like and subscribe for more practical health information from Bolt Pharmacy.